All right. Hello and welcome to tonight's webinar on muscle gain and weight loss with type 2 diabetes. I'm going to be your co-host here, and Dan Parsons is going to be running you through this webinar tonight. So just a quick heads up that your video will be turned off and your microphone will be muted, just so we can get through with a bit of ease. And if you've got any questions throughout, please pop them in the chat box. We can answer them at the end as well. But I'll let you take it away, Dan.
Yeah, hey guys, how you doing? My name's Dan Parsons. I'm an accredited exercise physiologist here at Hunter Rehab and Health in Waratah. Diabetes is what I specialize in. Diabetes is what I really enjoy working with. And today, hopefully, I get to teach you guys a little bit on muscle gain and weight loss with type 2 diabetes. Let's get straight into it, I guess. Let's do it. So what will we learn about today? The most important thing that we'll learn about today is why muscle building is so important in type 2 diabetes. We'll go a bit into depth into this a bit later, but it is really, really important. The other thing that I want to convey to everyone is how to safely and effectively increase your muscle mass while you lose your weight, living with type 2 diabetes. They don't always come together, and they are a lot of the time polar opposites when you want to increase muscle mass and lose weight, but it's really easily to do with the right training and the right diet and whatnot. Okay, so the importance of muscle building in type 2 diabetes. I'm sure that if you've been diagnosed with type 2 diabetes, or you are in those early stages of diagnosis, your doctors would have told you about insulin resistance. You are insulin resistant at the moment, or you're becoming more insulin resistant. Now, insulin is what carries the glucose from the bloodstream over into your muscles. So that sugar comes from your bloodstream over into your muscles, and the insulin is what does that. As you develop type 2 diabetes, that pathway doesn't work as much, and the insulin doesn't have much of an effect on the muscle, and the glucose can't go into those muscles. So then it stays in our bloodstream, it goes to our kidneys, our eyes, our feet, all those places, and it ends up with some really bad results if we don't look after it. Now, muscle building will actually help with that. It will help increase your insulin sensitivity. So it will create the muscles more sensitive to the insulin, so then the glucose can go into those muscles easier, basically. It's really cool how it does it. It's fantastic how it does it. There's other things that increase insulin sensitivity, like lower stress levels and diet. But exercise is one of the best ways to do that. And when you do exercise in the moment, you will decrease those sugars, which is absolutely fantastic. Another buzzword, I guess, is sarcopenia. I'm not sure if anybody's heard about sarcopenia, but essentially sarcopenia is the decrease in muscle mass as we age. Unfortunately, those who are living with type 2 diabetes, this happens a little bit more than others. Sarcopenia normally happens lots of different reasons, but one is sitting down and doing nothing, basically. So if we can increase our exercise and build our muscle, we'll decrease our sarcopenia rate, and therefore we won't become frail, which is my next point. Unfortunately, frailty is one of the biggest killers in Australia. So if we're nice and strong and active, we're less likely to fall over and hurt ourselves, and more likely to live a happy, healthier life. So if we can increase our muscle mass, we will increase our insulin sensitivity, which will decrease the amount of blood glucose, or the amount of sugars in your blood, which will stop all those things like the eyes, the kidneys, and all that kind of happen. And it'll also decrease how much muscle you lose as you age, and it will decrease how likely you are to fall and whatnot. So all those things are super important, and exercise can help with a lot of those. Now, resistance-based training, it can sound a little bit scary to some that haven't engaged in it before. I think a lot of people, when they think of weightlifting, think of, you know, those big weightlifters with massive muscles and their pecs, and they're on stage and they're flexing, but it's not always the case. That's an extreme amount of resistance-based training. There's lots of different ways that we can engage in a resistance-based program. One of those ways is a home-based program. Okay, so we can make you stronger at home. If you don't feel comfortable in a gym, we can do that at home. That's not a problem at all. We do that through TheraBands, for example, home weights, but we can also do it just through body weight, through certain exercises that I'll show you towards the end of the session tonight. Some really simple ways that we can increase our muscle mass and hopefully decrease a bit of that weight and insulin sensitivity and all those things that I've just spoken about. Another way is obviously a gym-based program. This is our gold standard for resistance-based programs. Ultimately, for progression and making things harder, we want to be in a gym. That's going to help things move along a little bit faster. But like I said, if you don't feel comfortable in a gym, not everybody does, we will move towards the home-based program. Now, there's other ways that we can engage in resistance-based program. For example, going for a long walk up a hill and doing some steps. Stepping up a step is basically a mini lunge over and over and over again. So I guess where I'm getting at is resistance-based program is just movement. We need to move more so we can build those muscle mass and be happier and healthier. Now, with diabetes, type 2, type 1 diabetes, it's super important that we have a look at our blood glucose levels before and after we exercise, and sometimes throughout as well. I've created this little guide here on where your sugar levels, where your blood glucose levels should be before, during, and after exercise. Okay. Now, I can get this to everyone. Please send us an email or put in the chat that if you would like this, and I can email it straight to you. This it comes straight off Diabetes Australia's page. I've just put it into a color chart for you. So below 4, when you test yourself, this is considered a hypoglycemic event. So we need to postpone exercise and we need to treat this as a hypoglycemic event. Hopefully everyone has those 6-day action plans for those events, whether it's lollies, milk, fruit, whatever it is. Get that into you, and hopefully you've developed that with your diabetes educator or your GP or your endocrinologist. If you haven't, I'd recommend that you go and do this. Get a bit of a plan together for when your blood sugars do get low. Now, in that 4 to 5 range, blood glucose range, we want to be a little bit careful here. Okay, so we want to eat something before we get on the before we start exercise, and this is a small piece of fruit or glass of milk. Okay, we want to bring those sugars up just a little bit. We want to bring those blood glucose levels up just a little bit. So when we're exercising, they don't drop down and we go into that hypoglycemic event. 5 to 10 is exactly where we want to be. If you get 7.5, ready to go. Let's pump it out and get into some exercise. So that 5 to 10 range is perfect. Now, when we go above that, something else happens in exercise. Okay, so that 10 to 14, we're only going gentle exercise here. We want to be careful here because if you engage in vigorous exercise, now when I say vigorous, that's going on a hard run, doing something like really high intensity training, your blood glucose levels will actually rise in those times. Okay, they'll rise quite rapidly and then they'll come back down quite rapidly after as well. So if you are above that 10 range, we want to be really careful, gentle exercise, retest, and then once we're in that 5 to 10, that's when we want to go and do that exercise. Okay, so just be careful above that. And above 15, this is a hyperglycemic event, and similar to the hypoglycemic, hopefully you've got an action plan together with your GP or your diabetes educator or endocrinologist on how best to navigate that. Everybody's different, so I'm not going to go into ways to describe that today. If you haven't got that, please book in and see someone and get some help with that. Now, goal setting. Goal setting is massive in exercise, and it's a massive motivator. I think everybody in exercise really struggles to get motivation. I know I do. I love exercise. It's my job. I love doing it, but sometimes I just can't be bothered. So I think this is where goal setting really, really is important. Okay. Now chuck into the chat if you do have any goals that you want out there. Otherwise, we'll get into it. So I guess SMART goals is the gold standard to goal setting. So let's take a random goal. Let me make one up. I want to lose weight. Okay. I hear that all the time at work, and it's fantastic. And that's the step one. Knowing what you want out of a goal is the first step. It's not specific. So the first S, specific, means we need to be specific. How much weight do you want to lose? Okay. Now that goal goes from I want to lose weight to I want to lose 5 kilos. Okay. We need an end. We need something that we're going to strive for and achieve. Measurable, we want it measurable. So in that case, it's easily measurable by stepping on some scales. Yeah, measurable. Achievable. Now this comes into the next one, the next couple a little bit more as well. So we want the goal to be achievable in a time frame that is relevant to you. Okay. Now 5 kilos for someone may lose that a lot faster than other people. Okay. So speaking with a healthcare professional and help setting out these goals will make a big difference, and then being able to share on how long they think and coming up with a plan together is, I think, the best way to go about this. But I think going to a healthcare professional and knowing your goal and being a bit timely about it and a bit specific is going to be super important. So a SMART goal will look like, instead of I want to lose weight, it will look like I want to lose weight. I want to lose 5 kilos in 6 weeks' time. Okay. 6 weeks is our time. 5 kilos is our amount. That gives us a very clear time frame and a very clear amount on how much we want to lose and how we're going to get there. The next step then is how we're going to get there. And that's where you can work with your healthcare provider or set out some steps for yourself on the amount of times per week you exercise, what type of exercise, all of that, that's going to get you to that goal. Most healthcare providers will be able to help you get there. Okay, now I've got a chair here. It seems a bit silly, but this is something that I quite often do with my clients. So all you need at home is a chair to measure this fitness goal, essentially, this fitness outcome and how fit I am compared to someone my age and gender. Okay. This is called a 30-second or a 60-second sit to stand assessment. All you need is a chair and a stopwatch. You're going to start sitting down on the chair, start your timer, and stand up and down from the chair as many times as you can in 30 seconds. Count that number and write it down. Okay. Then in 6 weeks' time, you do the same thing. And I want you to see if that increases, if that gets better. Okay. Really, really simple way on how to gauge your fitness, if you're getting stronger, if you're getting fitter. A 30-second sit to stand assessment. Really, really good. I use it all the time, and I think a lot of people do. I've got some quick example of some exercises here that people can do at home. Now, these are really, not everybody's going to be able to do these, and some people might find them easy, okay? The first one, much like our assessment that I just spoke you through, is simply a sit to stand assessment. Sit to stand exercise, sorry. Standing up and down from your chair. I've got in here, this person's going to do it 3 sets by 10 reps. So that means you stand up and down 10 times, have a rest, do it again. You do that 3 times. The next one is a wall push-up. All you need for this one is a wall. You go stand up and close to the wall and you go up and down. If you've got bad shoulders, this may not be for you, but work with a local exercise physiologist, might be able to help you out there. There's some regressions that can be made there. The last one, really simply, you just use that same chair from the first one, and it's a calf raise. All you're doing is coming up on your tippy toes, come up on your tippy toes and come back down, up and down. This is going to build some really big, strong muscles in the back of your legs there, which is going to help blood pump around and just get stronger, okay? Now, some of the biggest muscles in your body are in your lower body, so building those up will help with insulin sensitivity down there, and then more will get down and more glucose will go into the bloodstream and away from those areas that we don't want them. Now, in summary, so short and sweet today, why strength training is so important for diabetes? Insulin sensitivity. I want that. That's the most important phrase for anyone with type 2 diabetes or may having type 2 diabetes is we want to make those muscles more sensitive to the insulin so our glucose comes out of our bloodstream, okay? Super duper important so we don't become frail, like I said before, and so we don't become sarcopenic and you lose all your muscle. So like I said, increase sensitivity, decrease sarcopenia, and decrease frailty, which is overall going to give us better blood glucose control. It's going to decrease those HbA1cs. I'm sure that doctors have probably told you about this. HbA1cs, that's your indicator of a 3-monthly marker of how your glucose levels have been over 3 months. That will bring that down. Your GP, your endocrinologist, and diabetes educator are going to be super happy with you. But most importantly, you will feel better, you'll have a better quality of life, and you'll be much more in control of your health, okay? How can we safely engage in exercise? Now, I want to preface this with, if you feel like you can't safely engage in exercise, please see a professional like myself, an exercise physiologist, and they will be able to help you engage in the appropriate exercise. But if you're active and you know what you're doing, the first one is the gym. That's our gold standard. Get in there, lift some weights, move some things around and build some muscle that way. We can do it at home. Like I said, those exercises that I've just shown you easily can do it any home, as long as you have a chair and a wall, basically, that's not going to fall over. Super duper easy. Obviously, there's a lot more exercises that you can do at home as well. Yeah, it just takes time to build those up. And we want a goal set. That's going to set us, I think, when I say safely engage in exercise, it can be disheartening and it can really affect our mental health when we don't achieve what we want to achieve. So if we set those SMART goals and build goals that way so that we can achieve them, we're going to feel much better about what we're doing and engage and build some, some positive outcomes through there and hopefully look after your type 2 diabetes that you've been living with much better. Now, just briefly, I'm starting I've got some space in a group exercise class here in Waratah. I'm looking for 5 individuals left. We've already filled a couple of spaces, so we've got 5 left. We're going to focus on muscle building and weight loss, provide education throughout the session. We'll do some goal setting. It will be one-on-one, the goal setting and the exercise testing. It's at 6 p.m. on a Tuesday night, so same time as this here in our Waratah clinic. It's a private gym. You'll get an initial assessment that will be covered by Medicare bulk billed. That's where you and I will do our goal setting and exercise testing. We'll tell you where you're at and get some goals together and some plan. And then the classes thereon will just be $10.70 after you get your Medicare rebate. If you're interested in this, please type yes in the chat or we'll send you an email tomorrow and you can reply that way. Now, do we have any questions from the group at all?
Yes, we do have a question in the chat, Dan. We've got a question here from Inez, and it says, I've been diagnosed with type 2 diabetes. I've got severe arthritis in my hip. How can I exercise, for example, take a 30-minute walk when the extra stress on my hip will cause further pain?
Yeah, really tricky one. Absolutely. I do see this, and it's a massive barrier to exercise, but it doesn't mean that we can't overcome it. So for you, Ines, I think that seeing somebody that is trained that can give you exercises specifically to help you is going to be important. That person would be an exercise physiologist. Now, there are different exercises that we can do. So a 30-minute walk, for example, is just one example. But there's other things like a pool. We can walk in the pool up and down. Maybe that will feel better for your hip. Maybe it won't. Swimming. There's lots of different things that we can do to engage in exercise that don't involve the hip. The exercise will help the arthritis as well. If you see a professional like myself, we can help build muscles around that hip to then better support it. And then hopefully you can start engaging in that walking and that other stuff that you have mentioned. I hope that answers your question. It can be tricky, but my advice there would be see somebody that can help you out with that. Yeah. Any other questions there?
No, I think there's a few interested people here for the class. So, yep, like we said, we can put an email out tomorrow, and that'll have all the information in it as well. And you can just reply to the email with those classes. They will be starting in the new year. Is that right, Dan? January?
Yeah, they'll start in January. Just got to get some ducks in a row with the initials. So we'll try to get through the goal setting and the exercise testing stuff before Christmas, preferably. And then, yeah, hopefully the sessions will start early next year.
Excellent. Perfect. Awesome. Thank you very much for everyone attending. We really hope that was helpful. And like I said, we're just an email away if you've got any questions at all. But thanks again for your time, Dan.
Thank you. Appreciate everybody showing up. Fantastic.
All right. Bye for now.